Hi, Dr. Jenna Andrade, the Active Persons Chiropractor, and today I am going to be talking about ways that we can treat runner's knee. I have a previous video talking about what it is and some of the common things that we see when you may be struggling with runner's knee. Now I want to talk about how we can actually treat it. Just a quick rundown again of what runner's knee is. It is also known as patellofemoral syndrome. The patella is the kneecap, the femur or femoral is the fibrum. So it is a dysfunction between the interaction of those two. When we run or do other activities and we have flexion and extension of the knee, that kneecap actually tracks and goes up and down onto that femur, and that can cause problems if we have misalignment, if we have imbalance in the muscles, if we have softening of the cartilage underneath the patella, if we actually had an actual blow to the knee, so say you fell on it or something hit it, all of those things that could cause irritation to the knee. And there's a couple different things we can do to address those problems. If it's misalignment, we can adjust the knee. So we can adjust the kneecap, we can address the lower leg bone if that's the problem. We can also adjust the ankle, the foot, the pelvis, or the hip, because those can all be contributing to the mechanics in the knee. That's number one, we can adjust. And I definitely recommend that. If we get that joint moving well, we're gonna get fluid into the joint, which is gonna help it heal. It's also gonna help us to reset the muscles, which goes into one of our next causes, imbalanced muscles. So if we adjust, we can get those muscles to reset, and then we can give you exercises to actually retrain those muscles to do the job they were intended to do. So that's really, really important. Those always go together in my office. I always recommend an adjustment, and then we do a stabilization exercise to go along with that. To decrease inflammation and irritation for a time period, I would recommend that people reduce their amount of running or not run for a little bit. We want to reduce the impact into the knee, so we want to actually not be running on hard surfaces, so concrete and asphalt. I would recommend not doing that for a little bit. And then we want to avoid things that stress the knee even more, like hills or going up and down stairs. So those are a couple of the things that we can do to address the causes of runner's knee. Hopefully you found this helpful. Thanks for listening. Dr. Jenna Andrade, the Active Persons Chiropractor.